Well, it's time for another installment of Flashpoint. This week, Bridget Ellison talks with the Second Harvest Food Bank of Central Florida on how a pilot program is getting results for your health.
Good morning, I'm Bridget Ellison. Thanks for being with us. Good nutrition is an important part of leading a healthy lifestyle, but for some, it can be a challenge. That's why one local food bank has created a network to provide not only nutritious, but affordable food to those in need. Joining us today on Flashpoint, Karen Broussard, Vice President of the Agency Relations and Programs at Second Harvest Food Bank of Central Florida. Thanks for being with us. Welcome to Flashpoint.
Thank you. Happy to be here.
Glad to have you.
Yeah.
And we want to talk about the Healthy Pantry program today and who it's aiming to help. Tell us about it.
The Healthy Pantry program intends to help specifically those low-income, food-insecure people who also happen to be struggling with a diet-related disease like diabetes. That's a group that we've noticed, or we've learned really can't get well or manage their disease with the food that they can afford or access in their communities. So we've taken it upon ourselves, with a lot of help from colleagues around the country and certainly local partners, to join up with our nonprofit healthcare partners and clinic systems and figure out a way to build out a system of access specifically for those folks, to help them get well and manage their diseases in the best way that they can, really using food as medicine.
How did all of this come about? Because I'm sure the demand has always been there.
Yeah, the demand has always been there, but I think the recognition wasn't there. We didn't really start to understand what the potential was of joining with our healthcare partners to be able to make a difference. So we joined together with really about 14 or 15 nonprofit healthcare partners, clinics, hospitals, you name it, really in late 2015. And we asked the question, how could Second Harvest come alongside the work of these partners to improve the outcomes, the health outcomes, for these patients that they're seeing and treating, but nobody's getting anywhere, because there's no way these folks have access to the food that they need to follow the dietary prescriptions, really, and recommendations of their doctors by providing that. And now we've been able to come to a place where we think we know how to do that, and we have the ability for 3 years to pilot that concept.
Awesome. And so what kind of health issues are the food bank clients facing, and what percentage do they make up of the people you serve?
Right. So actually, I mean, it's really quite astounding. The issues that we see that are most predominant for the folks who are ultimately using the food pantries that we supply make up almost 30% of them actually are diabetic. Nearly 60% of them have high blood pressure. Those are all illnesses that are very much related to diet and nutrition. And so as we began to understand those numbers from various studies, from other research that we were understanding, because we have the great benefit of being part of the Feeding America network, so we get to share best practices and see research from other food banks around the country. We then started to realize that there's a great number of people who are getting food through the Central Florida, emergency and supplemental food system that we provide for. A great number of those people are getting the food now from our pantries. So it seemed like all of a sudden, oh, the pantry is the place where we might be able to help these folks. In 2013, we were really the fortunate beneficiaries of a wonderful community capital campaign that allowed us to open a new state-of-the-art building. And one of the most significant elements of that building is that we were able to increase our cooling and freezing space by about 400% from our former facility.
Which gave you the ability to give more fresh foods and more perishable items.
To be able to source much more fresh food and therefore distribute it. what we discovered and realized was going to happen really was the bottleneck was going to be, and a lot of people don't know this about Second Harvest. We don't distribute food directly to individuals. The food that we distribute goes out to a network of about 550 other nonprofits around 6 counties. That's where what we serve, and that's a lot of food. I mean, about 71,000 meals a week is going out. So over time, you start to realize that you really have the ability to impact if we can build capacity of that network. Also, with adequate freezing and cooling equipment, they also will be able to source and store and then distribute directly to the individual the food that they need to stay healthy.
And when we come back, we'll talk more with Karen, and we'll find out more about the clients and where they can get access to those healthy pantries. Welcome back to Flashpoint. Today we're talking with Karen Broussard from Second Harvest Food Bank, and we're talking about a pilot program that you'll be implementing called Healthy Pantries, providing healthy food for low-income families. And we've been talking about when this program started and how it works.
Exactly. So as I said, we started thinking about it when we brought our healthcare partners together last year in 2012. There was instant engagement when we said to them, we might be able to provide this food, and they were all like, what a great idea, because we do medicine, we know they need the food, but we didn't know how to do food, so thank you for this conversation. So we've spent a year or more figuring out exactly how we can do it. And what a lot of people don't know about Second Harvest is that we don't distribute the food. But we distribute the food to a network, an amazing network of 550 other nonprofits around 6 counties, and they then get the food into their community. This group, we will be selecting a group of pantries to create a subset of healthy pantries within our existing group of pantries. The people who run pantries are the most amazing people. They are invariably a very tiny staff and mostly volunteers, and they have a huge, huge passion for being able to help people in their own community. So that's what we'll be doing. We'll be working with a subset of those agencies to build their capacity, get the right kind of freezing and cooling equipment to them, so that they can then provide food to the folks who come in. But it's going to be a specific group of people who have already seen their docs, who have already been to the clinic, been to the hospital, and their doctor or practitioner will be giving them a food voucher. And the food voucher will be good for a period of time, maybe probably 60 or 90 days. And that will allow them to go to these healthy pantries, where they will be able to access exactly the kind of food they need to support optimum health for themselves and their families.
Let's talk about some of these types of foods. What are some of the foods provided and included in that?
Right. So the foods are really a lot of fresh produce. That is the food that is least available and least accessible to people who are low income and food insecure. It's either not available in their community, and or it's really more than they can afford for their food budget over the course of a month. Many people who use food pantries are also getting SNAP benefits, and generally those run out at the third week of the month. So those kinds of food, lean meats, low-fat dairy, eggs, great high-protein food, and lots of fresh vegetables. We'll also be able to have cooking classes and nutrition available at the pantries when folks are coming in, so that they can get familiar with how to cook them and how to use them and how to really just get very accustomed to cooking, eating, purchasing, accessing that kind of food as they watch their health hopefully improve.
And so are there time constraints on this? Because if someone's still struggling, say after 3 months, would the program be extended, or how does that work?
Well, this particular program, we're beginning this program, we're launching it with really generous support for a pilot from the West Orange Healthcare District, and it's a three-year grant. So we're going to start with increasing that capacity of those agencies for about the first year. We'll also simultaneously be working with the healthcare partners to get them accustomed to the prescribing food, so to speak, or giving those food vouchers, they'll be doing some screening. They'll be looking at some, blood sugar counts, A1C counts, BMI. And we on the pantry side will be looking at things like, did you have to miss work this month? Did you have to go to the emergency room because of your illness? If somebody is not doing better, we will keep working with them, certainly. We'll be able to continue that, and the grant is going to allow us to do that for the course of really up to 3 years.
Awesome. So that eligibility is based on where their needs are and how they change.
What their needs are, yes, exactly, and how they change. Exactly.
What happens, this will be in place by late this year, early next year,
right.
And you have plans to expand this. Is this just the wave of how food pantries will evolve over time?
Well, we certainly envision that. I don't think all pantries will become healthy pantries, but we really envision a network of the subset of our entire network, but a network of healthy pantries that sort of are geographically related to most of the nonprofit healthcare providers in the community. So we would love to see 3 or 4 near every nonprofit hospital, every clinic system, office, those kinds of things. We think that will have enough momentum and size, magnitude really, to be able to institutionalize it in our community, as hopefully we're watching people get better, and there's evidence that people get better doing this kind of
process. For now, is it Orange County or certain parts of Orange County?
Yeah, right now it's going to be isolated really to the West Orange County, which the actual footprint of the West Orange Healthcare District. So yeah. And we've got about 40 agencies in that area, and about 20 of them will be part of this program over the course of the 3 years.
And how will it be staffed?
We are in the process, actually, of recruiting someone who's got healthcare experience, but also understands the community that we work with, and we'll be able to work with the individual agencies to train them on a number of different elements that will help them be a healthy pantry. And as soon as that person is hired, and we're just maybe a week away from that, that process will begin. There will be individual training, group trainings with those agencies to help them understand what we're talking about. They'll get nutrition training. They'll understand who that now client is that's coming to them with the food voucher. That individual who's coordinating will also be able to work with the healthcare community so that they understand how the program works as well. And so we're all speaking a common language, and that's going to be important. At the same time, once we are able to bring in the patients now, we will be able to also offer cooking demonstrations and the nutrition education that we mentioned before.
Obviously, a lot of children and elderly fall into categories where they need help with this as well. How do you reach them?
Yeah, sure. One of the things that's going to happen in this program, when an individual comes with a food voucher, they will be given enough food for their entire family. We believe providing that food for the entire family is going to let the whole family learn about healthy foods. It'll serve a preventative process in that case. And so any children or elders that live in that same household will be able to get the benefit of much healthier food and much healthier food preparation in their family.
And how can the public help out with Second Harvest?
Well, we have just so many great things to do. We value our community so much. They have been so wonderful to us. And so whether people volunteer or they make donations to us or they just take an interest and want to visit and take a tour, we love for them to do that. Our website is chock full of opportunities. That's www.feedhopenow.org. You could spend a long time on there, and really that's the best way to get started. And there's phone numbers and emails that you can always get more information by dialing into those.
Well, Karen, thank you so much for being with us, and we're excited about the Healthy Pantry initiative. We'll be looking forward to following that in the news as well.
Good, thank you.
Thanks for being on Flashpoint.
Thanks.